AI, AI, AI. We've all heard it. It's all over the place. What's it stand for? Is it always interesting? Well, probably. But it's artificial intelligence. It's spreading everywhere. And today, as I walk in here to shoot a couple pieces with my staff, they tell me it's me against AI.
You dare challenge me?
We're gonna look up some questions. They gave me about 3, 4, 5 questions here. They want me to put those into this screen, see what the AI says, and also answer the question for you guys and tell you, is it accurate or is it not? So I'm tempted to whip out my iPad here and do my own research, but instead, we're just gonna go for it. Ready? First question, what if you are supposed to take a pill with water and you don't? Well, let's get Chat AI started here. Wow, this thing's whipping away. So here's the deal. You have to take pills with water because many times pills are not actually absorbed in the stomach. The water and the large ingestion of a volume pushes the pill through and helps it to go through the stomach faster into the environment where it's better absorbed, either in the proximal small bowel or further down. So one of the largest reasons for taking a pill with adequate quantity of water is to get it to the area of the bowel where it will best absorb. What did AI say? It depends on the specific type of medicine you're taking. Taking medication without water may make it more difficult for the medication to be absorbed properly. Man, this is pretty good. It could potentially cause irritation of the throat or esophagus. Well, I guess if it got stuck in your throat or esophagus, that's true as well. If you're forgetting to take a medication with water and remember within a few minutes, it's usually safe to take the medication with water as directed. Well, of course. If you remember an hour later, it's best to just follow the instructions on the label or consult with a healthcare provider. No. Do not call your doctor and consult with your healthcare provider if you forgot to take your pill with water. That's a little bit overkill. Then it answered a question we didn't answer. It says that some medications should not be taken with water, which was not the question we asked AI. So, was AI accurate? It was pretty good. It started off good. It said that we should take it with water because it's more difficult to be absorbed. And that's exactly how we answered, and that part is correct. The rest of AI's stuff here got off base a bit. Overall, on a scale to 1 to 10, I will give AI a 5 on the importance of using water while taking a pill. Okay, on to question number 2. AI, what are the most common symptoms associated with a subarachnoid hemorrhage? So let's get AI thinking here. So, most common symptoms associated with a subarachnoid hemorrhage tend to be headache. Sometimes people can be asymptomatic. Many people have variable symptoms. A lot of it depends on the location of the bleed and the reason for the bleed. Sometimes there's a spontaneous rupture of a vessel and a bleeding, for example, in the posterior circulation or the back part of the brain may cause symptoms like vertigo, loss of balance, vomiting, intense spinning. Subarachnoid hemorrhages in other areas of the brain may not cause any symptoms at all. The most common thing, though, is a sudden acute headache. In fact, in some situations, it's termed a thunderclap headache. So that would be our most common symptom. Now let's see what AI had to say. A subarachnoid hemorrhage is a type of stroke that occurs when there's bleeding in the space between the brain and the brain tissues that cover it. That is true. That is the definition of a subarachnoid hemorrhage. The most common symptoms of a subarachnoid hemorrhage, which is what our question was, is number 1, sudden headache. This is often described as a work headache of someone's life and is usually located at the front or back of the head. That is very accurate. That is the thunderclap headache we referred to. Nausea and vomiting. These symptoms may occur due to the pressure on the brain from the bleeding. True, depending on the size of the bleed. You could get that from pressure. You can also get that from the location of the bleed. But nausea and vomiting, that is very accurate as symptoms from subarachnoid hemorrhage. Stiff neck, most absolutely true. In fact, neck stiffness, while involved with many conditions, can be a sign of a subarachnoid hemorrhage. Sensitivity to light, again, location of the bleed could affect the optic nerves. Seizures could be a symptom in a very severe bleed where we're starting to get damage to the brain, and loss of consciousness in severe cases. Wow. AI remembered to go into some of the optical type symptoms you may have. Most importantly, AI defined better the more severe aspects of subarachnoid hemorrhage, which would indeed be seizure or loss of consciousness. AI, on a 1 to 10 scale, 9 out of 10. Dr. Ramos, 5. Question number 3. Next question down from my staff, we'll put it here. And honestly, I did not review these before coming in here, so this is kind of unfair. How is idiopathic, oh my gosh, you guys come up with some tough ones. How is idiopathic pulmonary fibrosis typically diagnosed? Please, AI, work quickly on this. because I need some help. How is idiopathic pulmonary fibrosis typically diagnosed? Okay, idiopathic pulmonary fibrosis is a condition where the lungs have a restrictive type of disease, more like a scarring. The idiopathic nature means we just don't know why. So often people will have shortness of breath, difficulty breathing, problems with exertion, and this restriction in our lungs makes it where they just can't get good air passage into the vascular system and into the body, and therefore function. Oftentimes it's diagnosed with pulmonary function tests. We can do different expired volumes from our lungs, and we can tell by how much air we can breathe in and how much we can push out if indeed we have pulmonary fibrosis. In more advanced or severe cases, you can actually take a biopsy of the lung, and that helps better define the pulmonary fibrosis. Okay, let's see how I did. Again, oh boy, AI wrote a lot. I hope it didn't outscore me on this one too. Idiopathic pulmonary fibrosis is a progressive and often fatal lung disease that causes scarring to the lungs. That is accurate. That's what I said as well. To diagnose idiopathic pulmonary fibrosis, doctors typically use a combination of medical history, physical exam, imaging tests, and pulmonary function tests. Here are some of the common diagnostic tests. Okay, with regard to that, AI went a little far. Of course there's a history and a physical exam. We were already given that this is somebody with pulmonary fibrosis. How is it that are we then going to diagnose it? So AI kind of flavors it up a little bit there. They don't get any points for that. Medical history, they're not getting any points for that. It goes in the medical history that the doctor would ask. Physical exam, I would say that that's a very important part of diagnosing pulmonary fibrosis because you can actually hear it and you can actually tell by how their inspiratory and expiratory volumes are, and AI has got that. The doctor will listen to the patient's lungs with a stethoscope and listen for the abnormal sounds. That is accurate. Chest x-ray can show scarring or fibrosis in the lungs. Can show it, non-specific. AI, a little bit down there. Pulmonary function test, there we go. It got the highest point here. These are tests that measure how well the lungs are functioning and can tell the severity of the disease. That is accurate. High resolution CT scanning. Oh, AI beat me. Absolutely. High resolution CT scanning absolutely does confirm scarring. It does show the extent of disease. AI remembered that. I didn't. And then blood tests. It says blood tests to rule out other possible sources of lung disease. No, that's not what this question was. It's not specific to pulmonary fibrosis. That's AI overdoing it again. Bronchoscopy, we did mention that, just not the word bronchoscopy. I mentioned that you might sometimes take a biopsy or a piece of lung tissue, and that's exactly what they do with bronchoscopy, which is they've described further here as inserting a long flexible tube. You can see that it explains it in non-doctor terms, which I think is very good actually. And this is how AI says to diagnose idiopathic pulmonary fibrosis. So I'm going to give AI a 9 again, and I'm going to give me an 8. AI was much better in explaining this in simple, easy to read terms. While the major points I was able to capture in my explanation, AI laid those points out in a clearer fashion, and it gave extra detail. In some cases, maybe not necessary, but certainly not hurtful. Overall, it was very accurate. AI gets a 9. Okay, on to our next one. And before I put this question in, I'm going to make a prediction because I'm seeing a pattern here. AI is going to answer some things that are probably associated with the next question. It's probably going to answer or say some things that are flowery, decorative language that aren't necessary really, and don't answer the question, but they describe some aspect of the condition. And my guess is it's probably going to be a little bit more thorough than me. Let's do it. Next question. What are the most important symptoms to look for in a patient with a possible myocardial infarction? Okay, myocardial infarction. Of course, AI, now see, I'm going to answer this better because I'm going to answer something like what AI would. It's going to say a myocardial infarction is a heart attack. This is a condition where the cardiac tissues do not get enough oxygen. It's probably going to say something like that, which I would never answer this question that way. But that's the more thorough way probably to give it to a patient, which is why patients nowadays probably prefer AI. Anyway, back to the question. What's the most important symptoms to look for in a patient with a possible myocardial infarction? People with a heart attack present in very specific ways. Oftentimes they present with shortness of breath, an inability to breathe, or a feeling like they're just not getting enough air. Chest pain, obviously, or pain with exertion if they're doing something, an activity. Sometimes they have pain down their left arm or up into their jaw. Sometimes they have unusual diaphoresis or sweating uncontrollably and they're not sure why. There are many different things you look for in a patient with a myocardial infarction. As you examine them, you might hear abnormal heart tones, rare but possible. You might see abnormal vital signs. Sometimes they're hypertensive, meaning blood pressure very high. Sometimes hypotensive, blood pressure very low if the heart is very much getting damaged. People with myocardial infarction look very uncomfortable in most scenarios. Now, in some cases, people who are suffering this myocardial infarction or a heart attack actually have no pain. Those are the hardest ones. We see this in people that sometimes have neurologic conditions where small nerves are affected. Particularly, you think of that in diabetics. So they can go anything from no symptoms to very severe symptoms. I've named a bunch of those symptoms and I've been specific. Now let's see what kind of jargon AI put out here for us. Okay, it says a myocardial infarction, commonly known as a heart attack. I knew it would do that. Is a serious and life-threatening medical emergency, of course. Most important symptoms to look for are, hey, it went right to the symptoms this time. I like it. AI didn't beat around the bush as much as it has been. Chest pain or discomfort, absolutely. This is the most common symptom of heart attack. It is often described as a feeling of pressure, tightness, or heaviness in the chest. Excellent description, absolutely accurate. And again, a little bit more detail than I gave. I talked about chest pain, but I would have been better off to describe it also as this pressure or heaviness. I think that's a really nice job by AI here. The pain may also radiate in the arms, neck, jaw, back, or stomach. We talked about that, predominantly arm and jaw, neck, back and stomach. AI is going a little bit overboard. AI loses a few points there. You start thinking about pain in your back or stomach. While yes, it can occur in myocardial infarction, very, very much the rare exception, and would lead you to potential other diagnoses such as an aortic dissection or potentially even an aortic aneurysm, something of those sorts. So that doesn't quite fit. Shortness of breath, they may feel like they can't catch their breath or difficulty breathing. That's exactly what I said. I would agree with that. Sweating, they can break it into this cold sweat, even if the room is not hot or cold. AI, again, it hit it right on with a symptom. But you see how it adds a little extra there? It says even if the room is not hot. Yeah, AI gives that little extra flavor. I actually like this. It really talks more like a human to a person. I go into doctor mode, and this thing goes into human mode. I think this is better. Dizziness or lightheadedness. When you feel dizzy or like they're going to pass out, very true. That could be from that low blood pressure that you can get. And then fatigue. Again, AI is reaching a little bit here on the fatigue. You may feel extremely tired or weak, even with little exertion. They can feel like they can't exert because they can't get the cardiac capacity to exert. Yes, fatigue, well, if we use fatigue, I think all of us would probably think we're having a heart attack every day. There's a lot of fatigue in all of us, I'm sure. It's important to note that not everyone experiences the same symptoms of a heart attack. Some people may not experience any symptoms at all. Oh, I wish it hadn't said that. I was going to finally outscore AI. I thought it was going to forget that sometimes you have no symptoms. But I remembered. Women, older adults, and people with diabetes, oh, it even goes into diabetes, may be more likely to experience atypical symptoms of heart attack. Good, this is good. And then it always ends with these same type of blanket statements. If you or someone you know is experiencing these symptoms, seek medical attention, blah, 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 blah. It said that on every one of these other questions as well. So, I think I probably finally pulled out a tie with the AI here. I'm going to give AI a 9.5 out of 10. I'm going to give myself a 9.5 out of 10. I don't think anybody's perfect, including AI. I think it did a fantastic job here. Overall today, AI versus the doctor, I think I'm going to have to hang my head in defeat. AI was very, very good. AI got the kind of fourth, fifth, and sixth generation, either symptoms or answers on pretty much every question. I was on top of maybe the first 2 or 3 or 4 important things, but AI was 1 or 2 better on a lot of these other than this last question. AI also spoke like a person. It was very down to earth, very simple to read. I could actually read it as a glance, and I swear to you, we did not do these questions beforehand. I saw them literally as I walked in here and sat down. But I'm able to glance at the screen and read it and interact with you because it's just written so friendly, so easy, simple terms. It's one thing in medicine that I think doctors forget to do sometimes is keep it simple. And AI has reminded me of that today. I think overall today, AI was very accurate. It did a very good job. It presented the data or the information better than I did, clearer than I did. I have heard that if you ask AI a question that is prior to 2021, where there's been new information since 2021, that it would be incorrect. So if one of the questions my staff had asked me today, for example, was, tell me the importance of semaglutide and its use in people with weight loss. Well, I would answer that question, I believe, much better than AI, because semaglutide for weight loss is a new medication for a condition that's old, but a new medication that's just being used with new indications, new dosing. And I think AI, well, want to try it? Let's do it. What is semaglutide used for, and how do you dose it? Let's say that. How do you dose it? Okay, so you see this is live right here. We're just from the hip. So semaglutide is a glucagon-like peptide agonist, GLP-1 agonist. What it does is there's a hormone in the body released by the liver that runs about, and it triggers basically our body to take glucose up. Glucose, as you know, is one of our basic builders of fat. So glucose gets taken up into cells, gets converted over, stored as fat. And circulating glucose is very hard on our system. That's why we have diabetics, why they check their sugars, for example. So semaglutide is used in type 2 diabetics and people with obesity. It's dosed at 0.25 milligrams once a week for the first month. That's for 4 weeks. Then it's increased to 0.5 milligrams per week for the next month. This escalation in dosing goes up by 0.25 milligrams every month. You take one dose a week, let me be clear. You take one dose a week at the start of the week on Monday. You take that same dose for a month. The next month, you take the same dose again every Monday. You do that for a month. But you increase it by 0.25 milligrams, up to a total of 2.4 milligrams, or until people have an adverse side effect. Usually that's nausea, GI side effects, vomiting, maybe even diarrhea or constipation. And people on this medication at a period of 6 to 8 months are shown to lose up to 15% of their body weight. It helps suppress appetite. How does it do that? GLP-1 agonists they're made in two areas in the brain. One is in the nervous system, one is in the pancreas, one is in the distal intestine. Once the hormone is made, it acts to basically slow intestinal mobility, meaning you don't move things through your intestine as fast. Makes you feel an early feeling of satiety in your stomach. You don't feel hungry as fast. GLP-1 agonists are very useful, such as semaglutide, for weight loss. Very useful in type 2 diabetics for sugar uptake. An adverse consequence of a GLP-1 agonist like semaglutide would be that if the uptake of the sugar was too substantial as a result of the semaglutide, what could happen is you could plummet your hemoglobin A1C. That's a measure of your body's glucose over a long period of time, like 90 days. If it drives it down too quickly, you can actually have adverse effects on your retina. Another thing you would worry about with semaglutide, for example, is in someone who had medullary thyroid cancer or multiple endocrine neoplasia. Those are diseases that if you use semaglutide, you could actually cause substantial harm to a patient. Okay, so those are my answers on semaglutide, what it's used for today, what its dose is. I even named some adverse consequences, some things to watch for, because that's what AI has been doing to me on every other question. Let's see what it said. Semaglutide is a medication used for the treatment of type 2 diabetes. Ooh, it's failing so far. It only got type 2 diabetes because that's old information. Weight loss, its primary use today, is newer, and it looks so far like AI has forgotten this. Let's see what it says next. It's a glucagon-like peptide 1 receptor agonist. Okay, we talked a lot about that. It's right here, which works by stimulating insulin release and suppressing glucagon secretion. True, that's the uptake of sugar through the stimulation of the insulin release. Saying the same thing, just in a different way that I did, resulting in better blood glucose control. True. In addition, it may also produce weight loss. It's starting to lean into weight loss here. Semaglutide is usually given as an injection subcutaneously into the skin. I didn't talk about the method it was given. It is given under the skin subcutaneously. AI, point for AI. I talked about the dosing, but not how you got the dose. The dose and frequency may vary depending on the specific formulation and the individual's response. Here are some common dosing guidelines. Semaglutide once weekly injection. Starting dose is 0.25 milligram once a week for 4 weeks. It got it. Then it says followed by an increase to 0.5 milligram. Oh, that's right too. I thought it was said increasing at 0.5. It was you increase 0.25, which it got. It says followed by an increase to 0.5 milligrams once a week. That is accurate. Some people may benefit from a further increase to 1 milligram once a week. That's accurate as well. Let's see if it goes up to the maximum dose. Semaglutide, it doesn't. It didn't go up to the maximum dose. Yes, it stopped at 1 milligram. No, semaglutide can continue to be increased at 0.25 milligrams all the way up to 2.4 milligrams. AI missed it. Semaglutide oral tablets. The oral dose is usually 3 milligrams a day for 30 days. Oral tablets are not even used hardly today at all. The reason that you don't use semaglutide typically orally is this. Semaglutide is a peptide. Peptides are simply chains of amino acids that are stuck together. When you take a peptide in, if you take it orally, there's a first pass metabolism. What that means is you take it, it goes into your GI tract, it gets absorbed and goes to the liver and gets metabolized, then it gets sent to the heart and then out to the whole system. So what you get is actually not initially what you took. So first pass metabolism, the things that are taken orally, are not the same thing as things that we inject and we get directly the organ type effect. Semaglutide's a little iffy here. It says it's followed by increase to 7 milligrams once a day, and some people increase to 14 milligrams on this oral dosing stuff. I'm sorry here, AI. I think you have really missed the ballpark here. So, what I said is right, and I think that is if you give AI a topic that has newer information on it, you get sometimes information you would not want to rely on. This is a good example of that. I like the explanation I gave on semaglutide much better than the example that AI gave. I would give myself a 9 on a 1 to 10 scale. I would give AI a 6 on a 1 to 10 scale on a newer topic. I hope this helped today. This was fun. You guys need to give me easier questions next time because those questions were not that easy. But that was a lot of fun. Take care.